Hi, I'm Kimberly Guillory. I am a OBGYN at Magnolia Obstetrics and Gynecology. Today I'm going to discuss with y'all the well woman's exam. Well woman's exam essentially is when women come to see me and we will get your vital signs including blood pressure, height and weight. The actual exam will include a general physical exam, and the difference with a gynecologist is you will get a clinical breast exam and a pelvic exam. So a clinical breast exam is when you lay down on the exam table and we palpate your breasts. We look for lumps and any irregularities, look for tenderness, anything like that. Essentially, we're learning the contour of your breast. And when I go through the exam with you, I typically will ask if you perform self-breast exams and let you know if I feel anything abnormal or you tell me if you feel anything abnormal. We will typically start doing breast exams after the age of 19, sometimes 21, just depending on whether or not you have a complaint. We also will do a pelvic exam. When people come to see a gynecologist, a lot of times you will expect to have a pap smear. Now, a pap smear is something that we do. It's a screening test for cervical cancer. Cervical cancer is a very slow-growing cancer, so when we do a pap smear, what we look at is cells of your cervix. And when the pathologist looks at the cell of the cervix, if it comes back normal, you actually don't need a pap smear every year, just depending on how old you are. That's something that we can absolutely discuss when you come and see us. So one of the things that women don't know, recently guidelines have changed and we actually do not do pap smears every year on women. So potentially you can get a pap smear every 3 years or 5 years, depending on how old you are and if it is normal. After we do your pap smear, we will ask you if you have any issues with or concerns with your female parts, and we will discuss different things. We talk about birth control options if you desire that, STD screening if you desire that. We go over women's health, different things, concerns about your periods, whether they're painful, whether they're regular, whether they're heavy, and we can discuss different things to either help you with your periods or your concerns that you have with that. That is pretty much a well woman's exam in a nutshell. I'll open it up for questions.
At what age should women begin with the well woman exams?
So well woman exams can begin pretty much whenever a female has a question. So if you are 13 years old and you're concerned about your periods, or if they're irregular, or if you're 19 years old and now you're sexually active, it really is one of those things that it's up to you. At the very latest, you would need to come at 21. At age 21 is when we begin doing pap smears.
Is there any age when you should stop? You don't have to come every year.
We really encourage women to come for their annual exam every year. So even if you are no longer have a cervix or you're not sexually active in the very young or the very old, we still do a pelvic exam on women who have gone through menopause or even have had hysterectomies. And that's important for us to try and detect things like ovarian cancer or any other issues that you might have.
Are there different screenings as you get older that would happen?
So typically in women, ages 21 to 65 is usually the pap smear ages. If you are older than 65 and you've had 2 negative pap smears in the last 10 years, you actually no longer need a pap smear, just a pelvic exam. However, we do encourage women at the age of 40 to start doing mammograms, which is detection for breast cancer, screening test for breast cancer.
If you have a family history of breast cancer, should you come earlier?
So we typically recommend women come to see us whenever they desire. if you do have a family history of breast cancer, coming and getting a mammogram typically will happen 10 years prior to the youngest person with cancer. So if you have a relative, mother who had breast cancer at 45, we would typically have you come and start doing mammograms at 35.
I've heard elsewhere that providers are saying that you really shouldn't do the clinical breast exam because it's not effective. Do you have an opinion on that?
So per the literature, 50% of women under the age of 50 will detect their own breast cancer. 75% of women over the age of 50 will detect their own breast cancer. So it's important for us to have you know what your normal contour of your breast is. So if you come and see me as a gynecologist every year, I will do a breast exam on you. If I do not detect anything, and in 6 months you detect something, we can then get on the ball and start doing diagnostic examinations and trying to figure out what it is that you felt. And that way, if it is a cancer or something that's abnormal, the prevention starts earlier versus waiting a whole year to get intervention done.
Can you go over all of the different, all the different procedures that will happen at a well woman exam?
So we typically get your vital signs, which includes blood pressure, height and weight, your respirations, your pulse rate. When you come into the room, we will do a general physical exam on you, palpate your abdomen. We also, as a gynecologist, we will do a clinical breast exam on you as well as a pelvic exam, plus or minus a pap smear. Well, thank you very much. And once again, my name is Kimberly Guillory, and I am a physician at Magnolia Obstetrics and Gynecology. Thanks for tuning in.